The National Diabetes Prevention Program is a program that was developed by the Center for Disease Control and Prevention. And essentially it's an evidence-based lifestyle change program targeted at people with a condition known as prediabetes, essentially people who are at a significantly increased risk of developing type 2 diabetes. So the risk factors for diabetes include being a pre-diabetic, age greater than 45, being overweight, having a family history of type 2 diabetes, as well as having high blood pressure. Women who had diabetes develop transitionally through their pregnancy, called gestational diabetes, or women who have given birth to children 9 pounds or greater. All those risk factors increase your risk of ultimately developing type 2 diabetes. Most recent studies show that up to 1 out of 3 Americans actually has prediabetes. About 110 million people in the US that have prediabetes. The staggering numbers with that is that over 90% of the people with prediabetes don't actually know they have it. And the reason why that's significant is obviously if these folks don't know they have the condition, they're unlikely to be doing anything about it. And consequently, not doing anything about it puts them at increased risk of progressing to full diabetes. Almost 29 million Americans actually have diabetes. So the combination of the prediabetes and the diabetes clearly forms an extremely large population. People who enroll in this program can expect to work side by side with lifestyle coaches, essentially trained facilitators who will help them make better food choices, help encourage them to increase their physical activity, and ultimately learn the skills necessary to maintain those healthy food choices and maintain the weight loss.
What the program does is, instead of becoming diabetic like they want to become healthy and not develop diabetes, which involves a change in their exercise, eating, and lifestyle. And this program goes over a 12-month period, and throughout that time we are giving folks information to help them with this decision making. We introduce the idea of exercise very early in the program and the importance of it. The thing is to get moving and finding a passion in an exercise that will work for you. We do everything we can to assist people to be on their own after this year. This ultimately is going to be a way to prevent diabetes, and it works.
The role of the healthcare professional is a crucial one. The role of the healthcare professional is to be able to identify this patient population. So what they should be looking for are people at risk, and identifying these patients is key in order to prevent progression or reduce the risk of progression to diabetes and all that comes with the condition of diabetes, such as many folks with diabetes ultimately develop kidney failure, so you're looking potentially at dialysis. Many folks develop blindness along the way. Also, identifying these patients and reducing the incidence of diabetes can help reduce the risk of heart attack and stroke. Clearly all significant medical conditions. On a national level, diabetes is a huge problem. Most studies would indicate that approximately $336 billion are going to be spent in direct diabetes care over the next 2 decades. Given the fact that diabetes is a largely preventable disease, I think we can all play a role in trying to have an impact on reducing the incidence of diabetes, both the individual as well as the healthcare provider, by identifying these patients who might benefit by a lifestyle change intervention, which has been proven to be helpful.